to depolarize, and thereby they block apoptosis. So a tumor cell which has a high content of calcium cannot undergo apoptosis anymore. And this is a basic mechanism of how tumor cells protect themselves. On the other side, they produce a high acidity in the vicinity of the tumor cells, and we have shown that if you lower your pH below 7.0, you won't have any immune activation anymore. So this is how the tumor cell protects itself against immune attack. So what we have to do in this situation, we have to regulate and rebalance it. This is just an illustration of a glioblastoma tumor cell with a PET-CT where you visualize the glucose uptake in the tumor. And you see, in comparison to the healthy tumor tissue, there is a significant upregulation of glucose uptake, which is necessary to produce the ATP, but at the same time protects the tumor from being defeated. And the same thing here illustrated for an animal experiment where they induced sarcoma in a mouse. You see the nuclei of the cells, and the red fluorescent dye indicates the polarization, and the mitochondria cannot depolarize anymore in comparison to animals with the same tumor treated with DCA, where you have depolarization. The tumor can undergo apoptosis, and you see the size of the tumor after 4 weeks, it significantly shrinked in the DCA-treated animals. Another substance which I think is very crucial in the concept of the protocols which I'm going to explain to you is procluster. Procluster, the name comes from procaine. Procaine, you all know, it's a local anesthetic which we use for many years. But the former procaine, the normal procaine, is bound to hydrochloride, which is an acid. And we have formulated a new molecule where we incluster this procaine into 4 molecules of sodium bicarbonate, which is a basic substance, and this has a significant different impact. And it has been shown that procaine has a very substantial beneficial action on the perfusion microcirculation, for instance, in diabetic ulcers. It has a sympathicolytic activity, which reduces the tonus of sympathetic nervous system. It's very good in a balancing way for overstressed persons. And it also functions as an antioxidant. And on top of this, it has an anti-cancer protective activity because it can demethylate and inactivate certain oncogenes, and which is of interest to oncologists. And it also has shown, and this might be of interest to you, that a lot of the side effects of chemotherapy, polyneuropathy and others, can be relieved with the infusion of this substance. And for instance, if you go into the literature, you will see that I've checked that except for 2 chemotherapeutic drugs, all others have an optimal efficacy in a basic environment. So this is one of the reasons why I think a lot of chemotherapeutic drugs fail, because they act upon an inflamed environment. And so if you reset the pH in the microenvironment, which is procluster doing, then you will have a better efficacy of your chemotherapeutic drug. And this is just a picture how you have to visualize this molecule. You see in the center there's the procaine, procainium, and this is embedded into sodium bicarbonate molecules, which is also attractive to us in the sense that you have a positive charged outer molecule, and only where the molecule is bound to negative charged molecules as we have it in acidic tissue, it is the procluster molecule is released and can bring up the pH. So we have a selective activation of the procrein only at sites of inflammation and acidity. We have tested this in comparison to the former procrein, which is bound to hydrochloride, and you see the pH in full blood and in plasma, that only the 1 and 2% application in comparison to the correspondent old procrein formulation, only the new procrein formulation really can bring up significantly the pH in the patients. It also has been tested in a lot of patients to look how this procrein can relieve pain. And there was a cohort of different patients with pain from cancer, arthritis, gout, whatever can cause pain. They did not subdivers these patients, but whatever was the cause of the disease, of the pain, you see that this is a treatment, and 4 weeks later patients were asked to fill out a score, and in the majority, 54% had a very good reaction to the pain, reported no pain at all. They said it's okay, they were better, and only 10% did not have an improvement in pain in the statistic scoring. As far as life quality is concerned, here patients were looked at who suffered specifically from pain from cancer and chemotherapy, and except for this is 13%, the rest reported a beneficial life quality under treatment with procluster. This illustrates another interesting case concerning the microcirculation. A patient, 54 years old, with a deep chronic ulcer at the left dorsal foot, caused by osteomyelitis after kidney transplantation and immunosuppressive therapy. See the picture here. He was treated at the University Hospital in Jena in Germany. He had 12 plastic operations with autologous skin transplants. It always superinfected wound ulcerations. There is no way they wanted to go on with that. So they treated him then with the procluster infusions twice a week and tablets. And you see both sides, at the front arm and the lower extremity, healed off just by giving these infusions. So this brings me to our first protocol, where we have assorted a composition of compounds which I think can restore the pH, the microenvironment, by giving relief, by injecting the dichloroacid, DCA. We will normalize the physiologic glucose oxidation of the mitochondria, which is very important. Balance is a compound which has choline citrate, which is very good to normalize sympathetic and parasympathetic activity. Energy is just an infusion which contains essential amino acids, but in a dosage which you will never get from eating any nutrition, which can restore other important enzyme functions. And power is, I think, a really smart product. It's basically galactose. But galactose is a sugar which can be taken up by our brain cells in an insulin-independent way. So I showed you, if you have this blockage of the sirtuin and the insulin receptor in the brain, insulin will not come in, you will have an inflammation. If you take power, this can be substituted, the brain cell becomes energy, and the whole inflammation resides. So in all neurodegenerative diseases, and to activate stem cells in the brain, we combine it with power. So the patient undergoes a 3-day treatment with these different compounds, and you will find a brochure with flyers where this is depicted for you how to do it, because it is important to really start with diclo, then take relief, and then balance. Don't do it the other way around, balance, relief, diclo. Take the priority, first that, then this, second day this, and then this is all you have to look at. And in addition to this, for 1 month, we supply, in this kit, we supply the capsules which will sustain the effect of the infusion. Quinomid and vitamin D. Quinomid is Q10, which is important for the mitochondria. As you know, vitamin D3 is a very essential hormone, basically, to be anti-inflammatory, to protect against cancer and autoimmune disease. Boswai, Frankenstein herb has a good anti-inflammatory action, and resveratrol, you might know, is a Japanese herb from knotweed, which has been shown to protect stem cell functions.
This therapy, what patients are suitable for?
Well, I will show you, because I assumed this question. Now, in order, I mean, I'm a scientist, so I want to see whether my treatment works or whether I'm on the right side. So this is a patient who comes with high inflammatory glycoproteins, and I'll tell you what this is in a second. You measure CRP, high sensitive CRP, homocysteine. These are markers which are upregulated in these patients, so you know there is an inflammatory background. It does not mean that the patient actually has any complaints, but if you measure that in your patients and you see this is high, then you know something is going on. And I think these are ideal patients to really do this. And we have a lab, a European lab in Brussels, which looks for glycoproteins and glycolipids, and the green dots are illustrating certain glycoproteins, and the red dots are illustrating lipids. And if you see a patient like this with, okay, I have to explain. You see, this is a chart where you have a standard deviation. So from 0 to 0.5 or minus 0.5, this is the standard range, which is normal. All dots in here are normal compared to a patient same age and same gender. They have more than 10 million database sets, so they know exactly what's normal and what is increased or reduced. So if you get this chart, and you could also send it to Brussels, no problem, then they will give you this spreadsheet, and you will see, oh wow, the green dots are glycoproteins, so they illustrate a very strong inflammation in the patient. So you see here, this is far out. This is a standard deviation of 3 point something. This is 1 in 10,000 patients who would come up just by chance where you would see that. So after a treatment, I think he got 2 cycles of the infusions. You see how your dots, they migrate, and how this has been improved. The inflammation is gone. And this illustrates the efficacy of the treatment. Now, if you have a patient with acute pain, this illustrates acute inflammation like gout or arthritis, joint pain, then we use this protocol. This protocol combines DCA, the Brock cluster. Brock cluster is relief. I mean, Brock cluster can be given as a tablet or an infusion, and the infusion is called relief, but it's the same compound. And procluster can be given as a local injection where you have a high concentration. So a lot of orthopedics combine this infusion with a local infiltration to really relieve the acute pain. For example, a male patient with recurrent gout, arthritis of small joints, and recurrent inflammatory episodes, he got this treatment twice within 2 weeks and the local injections. And you see also in this acute pain is very often also associated with inflammation as indicated here. And you see the improvement of the two charts here. But it's, I mean, the problem with this chart is it takes about 3 weeks until you get the results because it's a very complex methodology. So just check for high sensitive CRP, homocysteine, or do the diagnostic with the thermal scanner, which we also do, where you can visualize the inflammation with red spots coming blue, and then the patient sees directly what's going on. And this is our cancer complementary therapy, which I explained to you, which will normalize the tumor metabolism to undergo apoptosis and to bring up the pH with relief in order to allow an immune response to the tissue. And we combine it with balance and vitamin B complex because a lot of the cancer patients I see, they are undergoing chemotherapeutic treatment and they have a polyneuritis, and this also is very efficient in treating these adverse effects of the chemotherapy. Just an example again here of a lady with a breast cancer, operated, radiation, first, second line chemotherapy. Nevertheless, she has tumor progression with hepatic metastasis. You look at her profile, it's far out. Lipoglycoproteins, the red dots, glycoproteins, green dots, are really improving within 4 weeks after giving these 3 cycles of infusions. So the patient really feels much better, and the point is you don't risk anything because you can go on with your standard therapy, and this therapy has no side effects. Age preventive, it's only a 2-day treatment. Well, these are patients who come to you say, well, basically they have no complaint, they have no abnormal findings in the lab, but they say, doctor, what can I do in order to sustain my health and so on? And then I always say, well, we can naturalize detoxify your body and reinitiate a better function of your stem cells. That's basically what I say here. Because, keep in mind, I didn't mention that yet. There's also very solid, substantial literature showing that in an environment where your pH drops below 7.0, this is a critical threshold, stem cell function declines. So in any acid compartment, you will not have a repair mechanism from your stem cells, for instance, in the brain or the skin. So if you normalize the pH, which is done by relief, if you normalize mitochondrial activation, this is a compound mito, which really has a lot of essential compounds to stimulate normal mitochondrial function, and in combination with balance and energy, amino acids, I've seen a much better physiologic microenvironment with stem cell activation. So, for instance, here a 47-year-old mother, a lawyer, very stressed by the job, 3 children, 10, 12, 15 years old, feels exhausted, fears burnout. She comes and says, what can I do? You have a basically normal lab. This is her chart, and this is interesting. In these exhausted, stressed patients, we find a decline, especially in the lipoglycoproteins because they're so exhausted they can't form it anymore. And the control is the treatment, and you see how they move, the curve gets smaller, narrower, and you really can quantify the improvement of your treatment. Because in her you would not see CRP elevation, you would not see a thermal difference, so it's different to visualize to the patient.
And how often do you offer patients this infusion?
In that case, I say if you do this 3 times a year, then you're on the good, safe side. But the interesting fact is that once they had it, some of them, they come back after 6 weeks and say, just let me have it, please. I felt really better and sleep better and so on. And for detoxification, this is only when we really see that patients have high elevated heavy metals like mercury, lead, and then we do this, but you should then combine it with a chelating therapy, which you have here. That's why I didn't put it in. But this is synergenic with other treatments which we can use for detoxifying. So these are actually the examples of the various infusion protocols which are described in as flyers in our brochure. And if there are any questions, you may contact Alice, my partner, or me directly. And I also envision, if you really want to start with this, I really would like to come and to work with you for a certain period that everyone feels comfortable with the treatment, and it's more a routine thing then for you. Last point, if you may allow, so just this is a summary, a statement. I think these protocols, they will reset the physiological tissue pH. They can restore body's own stem cell function by normalizing the pH. They improve microcirculation and oxygen saturation. They prevent atherosclerotic vessel disease.